how are you today?
Good morning.
My name is Denise Mourning. I'm a Texas State University nurse practitioner student. I'm coming in, I'm going to ask you a lot of questions about what brought you in today and some of your past medical history before the doctor comes in to see you. Is that okay?
That's fine.
Okay. Can you please verify your information for me? What is your name?
My name is MMBM.
And your date of birth?
9/7/1900.
Okay, and that makes you
68.
68 years old, okay. That's what I have for you here. What would you like me for me to call you?
MM would be fine.
Okay. And what brings you in today? What brings you into the office?
For the past several days, I've been very short of breath.
Okay. For about how long?
Maybe 3 days.
Okay. And have you had shortness of breath before?
I have.
What normally makes you short of breath, or when are you the most short of breath?
Early in the morning.
In the morning.
And sometimes with exercise, and I live with my daughter and son-in-law, and there's a 2-year-old, and when I'm carrying her around, sometimes I get short of breath.
Okay. Is there anything that makes the shortness of breath better that you do?
Well, I think when I get up in the morning and start moving around a lot, and there's some persistent cough that goes along with it, and I drink some coffee, that seems to help. And then I have albuterol and Flovent that I use.
Is there anything that happens throughout the day that makes it worse besides getting up in the morning?
Just a strenuous exercise.
Okay. And you said you've had this shortness of breath before.
Right.
Do you have medication for it?
I do. I have the albuterol and the Flovent, and of course I'm on other medications for a lung infection. And then I have a flutter valve called an aerobica that I use.
Okay, so you do know how to manage it. Since you have had shortness of breath before, what brought you in today? What makes it different?
It just seems to be worse than it has been before.
Okay, and you said you were coughing. When you cough, is the cough dry? Is it wet? Does it cause you any pain? Is it productive?
It doesn't cause me any pain. It is a productive cough.
Okay, and what color is the sputum?
Sometimes it's clear, but sometimes it is yellow.
Okay. Have you noticed any blood in the sputum?
No, I haven't.
No blood. Do you have any other symptoms that go along with this cough and shortness of breath? No. And you said you were experiencing no pain?
No.
Okay, that's good. You say you live with your daughter and her family. Has anyone been sick? Is it that you've been around lately?
Well, the 5-year-old and the 2-year-old just have the normal seasonal colds and allergies too, but I think the colds have probably affected me a little bit.
Okay. Have you been running any fever or had any chills, night sweats?
No, I have not.
Nothing like that. Okay, good. Well, that kind of covers what brought you in today. We're going to go back a little bit and kind of review your past medical history so that we can kind of tie it all together and help you out today, okay? All right. Do you have any allergies to medications or food?
I'm allergic to tilapia, and I'm allergic to ethambutol, but I have been desensitized to the ethambutol.
Okay, so you're allergic to it, you've been desensitized to it, and you are currently taking it.
Right.
Okay. When were you desensitized?
The first time I was desensitized was in 2000, February of 2000.
Okay, you say the first time. Was there an additional time?
Then again in 2012, I think, of February also.
Okay, but you're not having any symptoms from
No.
taking it right now. Okay. What happened that you noticed that you were allergic to it?
I start itching, and I get really flush, almost hives on my neck, and then it goes into my face.
Okay. And you also stated that you are allergic to tilapia. What happens when you eat tilapia?
I have to have the itching, and I had swelling in my eyes, in my face.
So we just stay away from the tilapia. Okay. Tell me about what surgeries you've had.
Well, I had my tonsils out when I was about 4 years old, probably 1952.
Okay.
And, oh goodness,
Was that an outpatient procedure?
it was.
Okay.
It was like a clinic setting.
Okay.
And then after I had my fourth child in 1985, I had a tubal ligation.
And you were in the hospital because of birth and then the tubal ligation. About how
Right.
many days?
About 3 days.
Any complications?
No.
Okay. Another surgery?
And then I had lithotripsy because of kidney stones in 1988.
Okay. And did you spend time in the hospital then?
I did, a couple of days.
Okay. And just for that procedure, no complications, correct?
No.
Okay. Are there any other surgeries?
I had a partial lung removal, a lobectomy in May of 2000
Okay. What side?
on my right side.
Okay. And where was that done?
It was done at National Jewish Health in Denver, Colorado.
Okay. And how long were you hospitalized then?
About a week.
Did you have any complications from it?
No, I did not.
Have you had any complications since?
No.
Okay. And are you still followed by your pulmonologist and other doctors in Colorado at National Jewish?
Yes.
Okay.
I have a pulmonologist there and one here in Odessa.
Okay. Have you had, other than the times that you've had surgery, have you been hospitalized?
I fell and broke my pelvis in January of 2006, and I was hospitalized then.
Okay. But no surgery?
No.
Okay. Do you have any complications from that pelvic fracture?
No.
No. Okay. What happened? You rehab and?
I had outpatient physical therapy.
Okay. Okay. And you're doing pretty good.
Mm-hmm.
Okay. What about your past medical history? You said that you had MAC. Can you tell me about when that was diagnosed and how that came about?
That was diagnosed actually in the fall of 1999.
Okay. And what did you notice about the MAC? I mean, were you having shortness of breath? Were you coughing?
I had a productive cough, and that's how I knew something was wrong.
Okay. And in 1999, and then in 2000, you had the lobectomy because of this MAC,
Right.
correct? Have you had any, and you've had MAC ever since, or?
It went into remission, and then it came back about 2010 maybe.
Okay, and you're currently being treated for MAC.
Right.
How often do you go to National Jewish?
About every 6 months.
About every 6 months, okay. And they're following you there,
Mhm.
okay. All right, what about childhood illnesses? What kind of type of childhood illnesses did you have?
I had mumps and measles and chicken pox.
Okay, anything else?
I had pneumonia and was hospitalized for that
How old?
probably in 1954.
1954. Okay, and how long did you stay in the hospital for that?
Oh, about a week.
About a week, okay. And then you said you had, excuse me, you said you had lithotripsy in 1988 because you had kidney stones, correct? Okay. What else have you been diagnosed with?
Osteoporosis and high blood pressure.
Okay. When were you diagnosed with the osteoporosis?
Well, I was diagnosed with osteopenia in 2000.
Okay.
And then in 2006, when I broke my pelvis, they said it was osteoporosis.
Okay. Do you take medication for it?
I just take calcium and vitamin D3.
Okay, but no other osteoporosis medication. Okay. What other things have you been diagnosed with, diseases or illnesses?
I don't know. Got the high blood pressure and osteoporosis.
The hypertension you said. When was that diagnosed?
2010, I think.
Okay. And you take medication for that?
Right.
Okay. And then you fractured your pelvis and the osteoporosis. What about diabetes?
No.
No. High cholesterol?
No.
Any other respiratory issues?
I have bronchiectasis, and bronchiectasis is a factor in the Mycobacterium avium complex.
Okay. Is there anything else? And that was diagnosed at the same time as the
Right.
MAC? Okay. Anything else? There's nothing else. Okay.
Not that I know of.
Okay. Now, if you're ready, I would like to go over your medications.
Okay.
Is that okay? Let's see, I know you listed them somewhere on these papers for us, which is very helpful. Okay. What medications are you currently taking?
I use Flonase,
Okay. Do you know?
and that's 2 sprays in each nostril daily.
Okay. What else do you take?
And I have been diagnosed with reflux, and so I take ranitidine,
Okay.
150 milligrams for that.
Okay, so you take 150 milligrams of Pepsid once a day?
Once a day in the evening.
In the evening. Okay, and when were you diagnosed with reflux?
In 2000.
The same time as the MAC? Okay. Okay, I'm sorry, what other medications?
And I take amlodipine, 5 milligrams,
Mhm.
and losartan, 50 milligrams for the high blood pressure.
And those are both once a day?
Once a day in the morning.
Okay, and you said 5 milligrams on the amlodipine and 50 on the losartan, correct?
Right.
Okay, now what's the next medication?
And I take 500 milligrams of azithromycin once a day
Okay,
for the MAC.
okay,
And 1,000 milligrams of ethambutol once a day,
okay,
also for the MAC.
okay.
And 600 milligrams of rifampin.
And that's also for the infection?
Right.
Okay, and these are all prescribed from the hospital in Denver?
Yes.
And you said you visit them every 6 months. Do they continually check your liver and kidney enzymes?
Yes,
to
they
make sure
do, and I have had it
so
checked
far?
here
Okay,
also.
okay, good. Are there any additional medications you're taking?
I take Flovent, 2 puffs twice daily, and albuterol, 2 puffs twice daily.
Okay, and those are the medications you were talking about when you experienced the increased shortness of breath that you use in the morning?
Right.
Okay, do you use them additional times in the day if needed?
No, I shouldn't have to, but I have done it before.
So just once in the morning and once in the evening, and
right.
with your flutter valve in between?
Right.
Okay, and this helps
Mhm.
along with the coffee and then getting
Mhm.
moving. Okay, good. And then, are there any additional medications?
I take Benadryl when I need to,
Okay,
and there have been an occasion where I've had to take the Benadryl for ethambutol or tilapia. And then I take 600 milligrams of calcium twice a day.
for the osteoporosis.
And I have taken ibuprofen and Tylenol and vitamin D3.
Okay, so the calcium and the vitamin D for the osteoporosis. And then you stated you take ibuprofen and Tylenol
As
as
needed.
needed
Uh-huh.
for pain or whatever.
Right.
Okay, and then because you do have these allergies and you do take the ethambutol at home that you are allergic to, you do keep an EpiPen around, correct?
Yes, I do.
Okay, and do your family members know how to use it?
Yes.
Okay, good. What about immunizations? Are all your immunizations up to date?
I've had the flu shot in October of 2014,
Okay.
and the shingles in 2010, and then diphtheria, tetanus, and pertussis in 2012. And then the pneumonia shot I had in 2009, and I'm not sure whether I've had another one since then.
Okay, so those are good for 5 years. So if you haven't had one since 2009, we'll need to give you that before you leave today, okay?
Okay, thank
Especially with your breathing issues. What about, because you live with small children, the pertussis vaccine?
Oh, I have that. That was included with that tetanus.
Oh, okay, good,
Mhm.
good, okay. All right, now moving on to screening tests. When was your last pap smear, do you remember?
In 2010,
And the results?
it was normal.
Okay, what about a mammogram?
2013, and it was also,
Also
normal.
normal, okay, and the last and dreaded colonoscopy?
in December of 2013, and I did have one polyp,
One polyp.
but they told me to come back in 5 years, and that there was
No concern.
no concern with it.
Good, good. Okay, I think now because we've covered your past medical, past surgical, past hospitalizations, we can move on to your review of systems. Is there anything else I should know before we get started on that? No? Okay. So I see here you were born and raised in Texas, yes?
No, I was born in Michigan.
Michigan, sorry. But lived in Texas most of your life.
Right.
Correct. Okay. What year did you graduate high school?
1965.
And what year did you marry?
68.
And what was your occupation?
I was a teacher.
For how many years?
29 years.
What grade did you teach?
Mostly third.
Mostly third grade. So, grade school. Are you retired?
Yes, I am.
What year did you retire?
2007.
Okay, 2007. And what do you do with your time since being retired?
I have a number of social activities, and I'm involved in my church, and I help take care of my 2 granddaughters.
Okay, those are the granddaughters that you lived with.
Right.
So you stated you live with your daughter and son and 2 granddaughters, so you have a lot of support system. Do they help you out?
Yes, they do.
And you help them out, obviously, with the children. What about your husband? You didn't mention him.
He's deceased. He passed away in 2008.
I'm so sorry to hear that. What did he pass away from?
Well, I think it was complications from his diabetes, and then he had a massive heart attack.
Okay. Okay, but you lived with him until then.
Right.
And now you're living with your daughter. Okay, what time do you usually wake up in the morning?
About 7:30.
And what time do you normally go to bed?
Anywhere from 9:30 to 12. It varies.
So you get at least 8 hours of sleep a night?
Right.
That's good. Do you have
I
any
sleep very well.
Okay, no trouble sleeping. Good. Do you watch what you eat?
I try to, but I'm not very self-controlled.
And do you drink plenty of water or fluids?
Yes, I do.
Do you exercise?
On and off. I'm not very religious about exercising.
Nothing consistent. But you also don't live a sedentary type lifestyle?
No, I don't think so.
Okay. Are you able to do all of your activities of daily living by yourself, getting dressed, bathing, everything? You don't need anybody's assistance? Okay, good. Do you drink alcohol?
Occasionally.
Okay, how much would you say?
Well, maybe less than 1 drink a week.
Beer, liquor, wine?
Beer and wine.
Okay. What about, do you smoke?
I did smoke.
Okay, when did you stop?
The early 90s.
Okay, and how long did you smoke before that?
Probably about 20 years.
And how much per day?
1 pack a day.
Okay, well, you're about 25 years past, so that looks pretty good. Do you use any drugs, illicit drugs?
No.
Okay, and what about your coffee and tea intake? Do you have a lot of caffeine?
Yes, I do.
Okay.
Coffee.
Mainly in the morning or throughout the day?
Mainly in the morning, but I'd like to have a cup in the evening also.
Okay. All right. I'm going to ask you a little bit about your significant family history now, okay? Tell me a little bit about your father. How old was he when he passed away?
He was 80 years old.
80, okay. And what did he die of?
I think he died of a complication of kidney failure.
Okay. Did he have any other significant medical history?
He had an abdominal and aortic aneurysm.
Okay, and lived?
And lived.
Okay, and what about any other medical history? Hypertension?
He had
diabetes?
COPD.
Okay. Hypertension?
I think he probably had high blood pressure, but I'm not sure.
Okay. What about your mother? She living or deceased?
She had Alzheimer's and she's deceased.
Okay.
She died when she was about 82.
Okay. Any other significant history?
I said Alzheimer's. Oh, she had osteoporosis very badly.
Okay. And did she have hypertension, diabetes, high cholesterol? Nothing.
Just the high blood pressure.
Okay. What about your father's parents?
Father's
That would be
parents.
your
My
grandparents.
granddad, my dad's dad, died with throat cancer.
Okay. How old was he?
I would say he was probably in his late 70s.
And then your paternal grandmother?
She died of pneumonia when she was about 26 or 27.
Okay. And your maternal grandparents?
They both died of strokes,
Okay.
like massive strokes.
Both of them.
Uh-huh.
What ages?
My grandmother was 53. No, my grandfather was 53, and my grandmother was 63.
Okay. What about your siblings?
I'm the oldest of 3 girls, and the sister that's just younger than I has had thyroid cancer.
Okay. And your youngest sister?
No, she
Okay.
hasn't had anything
Significant.
significant.
Okay. And how many children did you have? Do you
4.
All living?
Uh-huh.
Okay. And tell me about the oldest.
The oldest is a son,
Age?
44.
Does he have any significant history? No. Okay. The next child?
She is 40, and she was diagnosed with melanoma, and it was surgically treated.
No, surgery. She's not on medication for it.
No.
Okay. She's routinely seen?
She's monitored
Okay.
frequently.
Okay. What about your third daughter?
She doesn't have anything.
How old is she?
She's 30,
Okay. No medical history. And what about your youngest?
and the youngest is 29,
Any medical
and
history?
she hasn't had any problems.
Okay.
Well, she does have a few stomach problems.
But no stomach cancer or anything?
No.
Okay. And then do your sisters have kids?
The sister that's just younger than I has one son,
How old is he?
and 35.
Okay. Any medical history?
No.
And what about your youngest sister?
The younger sister has 2 sons, and they have both had asthma.
Both have asthma.
Mhm.
Anything else besides that?
No.
Okay. Okay. Now,
My youngest sister did have her gallbladder out. And my mother did also.
okay. But you still have yours?
Yes, I do.
Okay, great. Okay, now I'm going to ask you some questions specifically about your body, okay, and your systems. Okay. Have you had any changes in weight recently?
No, not recently.
Okay, and you stated earlier that you have not had any fevers, chills, or night sweats. Is
No.
that correct? Okay. Do you have any problems with your skin? Skin dryness?
I do have a lot of skin dryness.
Is that now or always?
Always.
Always, okay. Do you have any moles that have change in appearance, size, or color?
No.
Okay. Do you bruise easily?
Not really. My skin is sun damaged, and I do,
Thin.
when I injure it, I do have problems. But
Okay. And no rash, hives, or sensitivity to sun?
No.
Just when you're taking something you're allergic to. Okay, what about your head? Do you have any headaches or dizziness?
No.
Have you had any changes in vision, spots or specks?
No.
Do you wear glasses all the time?
Yes.
Okay. Do you reading, driving at night all the time?
Right.
Okay. What about your ears? Do you have any hearing loss?
I do.
Okay. You're not wearing hearing aids. Do you have hearing aids?
No, I don't.
Okay. Have you been seen by an audiologist?
No. Well, I have. Yes, I have.
Okay. And what was their recommendation?
They didn't recommend, or they didn't say anything about my.
Just verified
Uh-huh.
your hearing loss. Okay. What about ringing in your ears?
I do have tinnitus.
Okay.
Yes.
Okay. Anything else with your ears?
No.
What about your nose? You said,
I have a stuffy nose from time to time.
okay, and seasonal allergies?
Right.
Okay. Throat, a little bit of drainage?
I seem to be clearing my throat more often than usual.
Okay. And your teeth, are those your teeth?
Yes, they are.
Okay, and do you see a dentist regularly? Okay, good. Have you had any pain or stiffness in your neck?
I have, and a doctor did tell me that I had some arthritis in my neck.
Okay, and any swollen or infected lymph nodes, that you can, any nodules in your neck?
No.
No. Okay. What about your breasts? Do you have any pain or discomfort in your breasts?
No.
Any discharge?
No.
Do you perform monthly self-examinations?
Yes, I do.
And you do get mammograms? Okay. Any issues with your heart besides your high blood pressure?
No.
Do you have varicose veins?
No.
Do you or have you ever had chest pain?
No.
Irregular heartbeats?
No.
Palpitations?
No.
Increased difficulty when you're laying flat at night?
I wondered if that has something to do with my shortness of breath.
Okay, have you ever noticed your legs or feet getting swollen?
No.
Any heart murmurs?
No.
Any cramps in your legs?
No.
Okay. Besides your productive cough and the occasional yellow sputum, or do you have any respiratory issues? You have the shortness of breath. No spitting up blood. Ever choke? No. And no night sweats?
No.
No. Okay. Now I'm going to ask you a little bit about your belly. You said that you do have reflux and you take the Pepcid for that. Have you had any changes in your appetite?
No.
Any nausea or vomiting?
No.
Frequent belching?
No.
Diarrhea? Constipation? Gas? Nothing. Notice any blood in your stools?
No.
Do you have hemorrhoids?
Yes.
Okay. Are you having any complications with them?
No.
No problems. Okay. Do you have painful urination?
Oh, no.
Any blood in your urine?
No.
I imagine because you're on the rifampin, your urine's a bright color. Is
Yes.
that correct?
Uh-huh.
Okay, and you're aware of that, right?
Yes.
Okay. Do you have frequency of urination at night?
No.
What about incontinence?
I do have a trouble with incontinence a little bit.
More when you're coughing and laughing?
Right.
Okay. Do you have any postmenopausal bleeding?
No.
Pain or itching? No. Okay. Do you have any muscle or joint pain? You said you do have the sickness in your neck. Any other?
Not really. I have some pain in my left foot at times.
Okay, and due to arthritis, or what do you?
I think it's probably arthritis, but it's nothing that I've ever had checked out.
No pain right now, though?
No.
Okay. Do you experience any nervousness or tension or depression? Have your mother had dementia? Do you have any memory changes, any mood changes?
I think that just goes along with getting older, and I can be forgetful.
Nothing that you're worried about?
No.
Okay. You said no headaches. Have you any changes in your attention span or your speech?
No.
Any lightheadedness, fainting, or paralysis?
No.
Okay. Any changes in sensations like numbness or tingling in your legs or fingers?
No.
Or anything? Okay. Are you anemic?
No.
Do you? You said you don't bruise easily, just normal with your skin thinning. Do you bleed easily? Notice your gums bleed ever?
No.
Okay. Are you sensitive to the cold or heat?
No.
And do you find yourself excessively hungry or thirsty?
No.
Okay. That completes my health history. Is there anything that we may have missed that you might want to tell me? No?
I don't think so.
Okay. Now we're going to get started on your physical examination. Is that okay?
Okay.